Hello, everybody. It's Ryan here, board certified specialist physician. Thank you so much for joining me. This is our 21st installment in the Practical Internal Medicine series, and we are talking about health. If you haven't yet subscribed to my channel, I strongly encourage you to smash the subscribe button. Just a quick joke to start things off. How do you get rid of a headache? Well, you put your head through a window, and the pain will disappear. Okay, guys, let's take from the Calgary Black Book. So you've got a headache. The first point is it primary or is it secondary? So primary means there's no etiology for it. Secondary means there is an underlying cause. So under primary, you look basically, is there a pattern or a periodicity to it? Does it occur in clusters or others? So if there's no pattern, then you're thinking about it being either uni or bilateral. If it's unilateral, typically pulsating, throbbing, you're thinking about a migraine headache with or without an aura. If it's bilateral, you're thinking about the most common headache that we all have, tension or stress headache, which is just classically described as a tightening or like a band-like sensation. If it occurs in clusters, then there's two certification points. Is it autonomic cephalgia, which typically lasts for minutes to hours, separated by hours, sudden onset, like a cluster headache? And the typical description of a cluster headache is it's orbital, it's sharp, you have dysautonomic features, tachycardia, diaphoresis, palpitation, and so forth, or hemicrania continua. Others, which last for seconds, separated by minutes to hours, thinking about trigeminal neuralgia, are typically described as shooting or stabbing. The headaches can have this weird and wonderful primary cough headache, primary exertional headache, or primary secondary headache. So these are all fitting under the idiopathic or the primary category. The secondary headaches are usually constant all the time, and these are usually to determine if there's any red flag symptoms. If there's red flag symptoms, you're thinking about systemic symptoms, focal neurological signs, sudden onset, older age, progressive signs of raised ICP. Clinically, the patient has a third and a sixth nerve palsy, meningism. Then you got to be concerned. But if there's none of these, there's no red flag symptoms. The next question to ask is it acute or chronic? So if it's acute, you're thinking about sinusitis, dental abscess, glaucoma, traumatic brain injury, mountain sickness, if applicable, right? Chronic, they blame drugs, and more drugs, analgesia, induced headache, or substance withdrawal. Now, practically now, you got a patient with a headache. You're going to ask the patient, is it chronic or episodic, or is it a new onset acute headache, which is, or is it change in the characteristics of pre-existing headache, which has gotten worse or is different? If that be the case, if it's a new headache or a worse headache than normal, history and examination. Is it intracranial caused? You're creating it, do a CT brain, especially if there's focal signs. CT brain can be diagnostic and can show you a hemorrhage, be it subarachnoid, subdural, extradural, interparenchymal bleed, or CT brain being negative, in which case creating subarachnoid hemorrhage or meningitis, in which case you should have some degree of neck stiffness. You want to do an LP. Or if you're creating a CVA or cerebral venous thrombosis, you want to consider CT angio or MRI or an MR venogram. Okay. The other protocol is a query glaucoma. Then you want to measure intraocular pressure. Querying giant cell arteritis, usually these older folks who have jaw claudication, headache, very tortuous temporal artery, raised ESR, you do a biopsy, start the patient on steroids, or else you're risking blindness. Okay, so but if it's chronic episodic headache with red flags, yes, then is it chronic and progressive headache? Go for a CT brain. You might see a tumor or an abscess or a space occupying lesion. Raised ICP, third and sixth nerve palsy, augmentation, do a CT brain. Okay, consider idiopathic intracranial hypertension if the CT brain is negative. Okay, and then and then other red flags: systemic illness. Think about drugs, malignancy, immunosuppression, FAO, and acromegaly. If it's a primary headache, the big three: tension, migraine, cluster. We already spoken about that. Okay, my friends, the book of Numbers, chapter 6, verse 24 to 26 says, "The Lord bless you and keep you." It's a beautiful song by Kerry Job. Also, I'm sure many of you know that this is like the benediction in many of our churches. The Lord bless and keep you. The Lord make his face shine upon you and be gracious to you. The Lord turn his face toward you and give you peace. May that be true for you. God bless. I'll see you soon. Here are my references. Take care.